Hello everyone. If you are a pharmacy student or nurse or just someone trying to understand a diabetic medications, classifying this drug can feel overwhelmed. Today we are going to break them down into their clinical families. To understand the classifications, you only need to know that type 2 diabetes has main two problems. The first one is insulin resistant, which means the body has insulin case but the lock on the cell are rusty. So second one is insulin deficiency. The pancreas is tired and isn't making enough insulin K. So every oral diabetes pills fit into a group designed to solve one of this specific problem. Let's look at the four major classes. So enhanced insulin secretion, or is also known as the insulin secretocoso, and this is just a medical word for something that focus on an organ to secrete or pump out substance. So this drug target to pancreas and force it to make more insulin case. So we divide them into the two subclasses. The first one is sulfonylurea. So this is the older highly effective family. So it has the example in two different generations. The first one is acetohexamine, chlorpropamide, tolazamide, tolbutamide, and second gen is glip glipizide, gliclazide, glimepiride, glibenclamide is also known as the glyburide. So this bind to the receptor on the pancreas and squeeze out insulin all day long. So second one is the meglitinide. So meglitinide, these are the glinides. So it has like rapaglinides and natiglinides. So they do exactly same job as sulfonylurea, but they work very rapidly and stay in the body for a short time, and they are taken right before the meal to stop the sugar spike after eating. So third one is DPP4 inhibitor, which means a dipeptidyl peptidase, and is also known as the incretin modifier. Incretin is a natural hormone which released by the gut after you eat to tell the pancreas to release insulin safety. So DPP4 inhibitor, these are also known as the gliptins such as the sitagliptin and valdagliptin and linagliptin. So these are it work by these are the natural enzyme in your body called DPP4 that destroy your gut helpful in incretin hormones. These pills inhibit or stop that enzyme by protecting your natural hormones. Your body can lower the blood sugar naturally, but only when the food is present, because they only work when you eat, so they rarely cause dangerous drop in the blood sugar. So this is the most important class. Overcome insulin resistance, which is also known as the insulin sensitizer. So this drug do not make more insulin, instead they fix the rusty logs, so your natural insulin can work better. So there are the main two subclasses here. So big one, so the famous example, most famous example is metformin. So it is the first line treatment for the type 2 diabetes. It works by reducing the amount of sugar released by the liver and helping muscles absorb glucose easily. And the second one is thiazolidines, which is also known as the TZD, and these are often called the glitazones. And the example is pioglitazone and risaglitazones. This work directly on the fat and the muscle cells to make them highly sensitive to the insulin. So this is the final class change, how the body absorb or remove the sugar entire without relying directly on the pancreas. The first one is alpha glucosidase inhibitor. So in example there is acarbose, maglitol and voglibose. These work directly on your intestine. They slow down the breakdown of the carbohydrate for your food, meaning the sugar enter your bloodstream much slower after a meal. So second one is SGLT2. inhibitor. Which means a sodium glucose co-transport to inhibitor. So these are the glyphagins. So glyphagins like infaglyphazones and dapagliffazones, and they work in the kidney instead of letting the kidney reabsorb sugar back into the blood, and this pills block that process and flushes the extra glucose out through your urines. Remember, every individual body is different. A pharmacist or a doctor select the specific pill or combinations that matches how your body handles sugar. Never change your dose or skip your medications without taking to your healthcare provider first. If you found this simple breakdown helpful for your study or your health, make sure to hit the like button and subscribe to the channel for more clear medication insights. See you in the next video. Thank you so much.